14. You are on night cover for a geriatric ward. As you are re-cannulating an 82-year-old female patient, she tells you that she wants to die. She asks you to help. Rank in order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Tell her that she will need to discuss this with the team in charge of her care, because, strictly speaking, she is not your patient. B. Sit and talk to her. Ask why she feels that way and try to ascertain if she has any signs of depression. C. Sit and talk to her. Ask why she feels that way and try to ascertain if she has capacity. D. Ask her if there is anyone whom you can call for her so that she can say goodbye. E. Finish the cannulation, leave the bedside, and relate the content of your conversation straight away to the nurse who is looking after her. Answer. C. D. B. A. E. 1. The key issues to consider are as follows. The blood needs to be retaken before the next morning's surgery. But although it is important, it is not an emergency. You must ensure it happens on time. As such, any options which consist solely of passing on a message without a clear idea of the deadline, or which run the risk of the deadline being missed, should be ranked down. 2. Documenting. Option E is important, as it will ensure that there is a clear trail. However, the option does not involve retaking the sample, and as such, it does not actually resolve the problem. Since all the other options ensure that the blood is taken again, option E will rank last. Option A, getting the phlebotomist to retake the blood the next morning, will come too late. It therefore ranks fourth. 3. Option B, handing the form to the ward sister, is not ideal because you have not given her a deadline. However, there is a better chance that it will get done on time than if you simply get the phlebotomist to do the test the following morning. Option A. Therefore, option B ranks over option A. 4. Option D, taking the blood yourself immediately, and option C, ensuring it gets done at some time today. Both ensure that the blood is taken again on time. Both options will ensure that the mistake is corrected. However, since the situation is not an emergency, the sample needs to be taken before surgery, that is before the next day. But that doesn't mean that you have to drop everything else for it. There is scope to conclude that option C is more realistic and therefore more appropriate than option D.